Good morning. I'm Sharon Gass. I'm a physical therapist assistant from the local physical therapy clinic right down the street. We treat different diagnoses for all sorts of ages. We also provide treatment for pain, surgical repairs, and joint replacements. And we treat arthritis. And that's what I'm going to talk about today. Is this how you feel some days? Do your knees sound like Rice Krispies? Today I'm going to talk about arthritis. There are different kinds of arthritis. There's rheumatoid and psoriatic arthritis, but we are going to learn about osteoarthritis today and the current treatment protocols. All treatments that we provide our patients are based on the most current research. As physical therapy professionals, we read and discuss amongst ourselves the research so we can provide our patients with the best possible care. Osteoarthritis, which I'm going to refer to as OA from now on, is caused by inflammation in the joint, which causes the bones and the cartilage in the joints to break down. Cartilage is kind of that crunchy stuff that's on the end of a chicken bone. Who's affected? 18% of women and 10% of men over the age of 60. Sorry, ladies. And of all those that suffer from OA, 25% of them struggle with completing daily tasks. Obesity is a BMI of 30 or above. In obesity, fat cells release a hormone called leptin, which causes inflammation in the joints. A link has been established between hand OA and increased leptin, so it does not always have to be a mechanical reason for OA. The theory is leptin causes increased inflammation in all the joints of the body. Is it the only reason for OA? Of course not. In several studies, type 2 diabetes actually causes issues with the bone under the cartilage and the growth and repair of cartilage. According to Johns Hopkins, metabolic syndrome is a cluster of symptoms which include increased waist size of 35 inches for women and 40 inches for men, high blood pressure above 130 over 80, fasting glucose above 100, triglycerides above 150, and HDL less than 40. The American Heart Association and the National Heart, Lung, and Blood Institute suggest that if a patient has 3 or more of these, they should be diagnosed with metabolic syndrome. The experts are not real sure on the causes of metabolic syndrome. Most believe it is from a sedentary lifestyle with diabetes involved. But does diabetes cause metabolic syndrome, or does metabolic syndrome cause diabetes? The jury is still out. But metabolic syndrome, obesity, and diabetes are all linked with OA. The current treatment for OA is symptom management. Studies show that just a 5% weight reduction decreases pain, increases function, and reduces white adipose tissue, which is the fat cells that produce leptin. And adding exercises, including aerobic, strengthening, and flexibility training, further enhance this weight loss. Joint replacement is only used for the severely compromised. Proper diet and nutrition aids in weight loss, and remember, losing just 5% of your weight will make a change. You really want to decrease your LDL cholesterol, which is your bad cholesterol. If you decrease your overall fat intake, make sure most of your fat is omega-3 fatty acids. And good sources include fish, walnuts, chia seeds, flax seeds, canola oil, and soy foods. Increasing your fiber will also help reduce your overall cholesterol. A proper diet will assist with weight loss, metabolic syndrome, and diabetes. Medicare will usually cover a visit to a dietitian once a year. On a cellular level, your body uses these little energy packets called ATP for energy. The cells in our bodies take glucose and break it down through a chemical process to form ATP. There's aerobic respiration that uses oxygen, and your cells use this for long-term use like house cleaning, walking, or grocery shopping. During anaerobic respiration, oxygen is not used, but is very short bursts of energy. like lifting that 50-pound bag of dog food in the car. Glucose is in almost all the food you eat, not just breads and sweets, but also fruit, vegetables, potatoes, rice, and grains. There's so much more that goes into this, but this just gives you a very basic understanding. When you exercise, you are actually stressing your system, which causes it to make changes to work more efficiently. You won't breathe as hard, the cellular respiration and that was shown in the previous slide becomes more efficient, which causes your muscles to become stronger with more endurance and reaction time improved. All this leads to decreased pain and improved balance and walking. There's no cookie cutter exercise program. Of course, we do some of the same exercises with patients, but everyone starts at a different place and there has to be progression. So you can't just do the same exercise over and over and expect to get better. According to SCOW, the recommendation is 12 supervised visits with a physical therapy professional, and the exercises must follow the American College of Sports Medicine guidelines, which means you have to exercise it at certain frequency, intensity, time, and type, depending on where you start and where you want to go. Based on the patient abilities and their goals, aerobic activity will be 3 to 5 times a week in 20 to 30 minutes, strengthening 2 to 3 times a week, and stretching every day. Exercise is the first line treatment of OA. Physical therapy does not fix you. We give you the tools to manage your symptoms on your own. When you start out, you will be doing clinic exercise and exercise at home. When you finish your physical therapy sessions, you will continue on your own. Diet, cardiovascular exercise, strengthening, and stretching all work together to help manage your OA, and this may help your overall health. These are my resources. If you would like a copy, I would be happy to provide you with one. Are there any questions?